I'm Dr. Giles, a pediatrician here in Las Vegas. I started this channel to give parents practical and trustworthy advice, the kind of advice that I give to my patients every day here in clinic. Now, having a sick child is never fun. There's the fever, the cough, the congestion, the runny nose, the constant crying, and the need to be held. And then, as the days go on, that nagging question in the back of your head, is this just a virus, or do I need to go get some antibiotics? Well, today, hopefully I can help to answer that question just a little bit better for you. So let's start off with what a viral illness is. Viruses are the most common cause of illness in children. Now, symptoms are what you get with the common cold. So cough, congestion, fever, runny nose, sometimes body aches, headaches, nausea, vomiting, or diarrhea. And what's worse is that these symptoms get worse in the first 3 to 5 days. And then after that, gradually get better. So then what's a bacteria? Well, bacteria, they like warm, wet, moist places. Places like that in your body include your middle ear, your sinuses, your throat. And so as your kids start to complain about that, their ear hurting, their face hurting, the headaches, sore throat, this may be a sign that there's a bacteria growing. Now, why does it matter so much to know if it's a bacteria or a virus? Well, bacteria we can treat with antibiotics. Antibiotics help to kill the bacteria and help our body to clear it from our system. Viruses, on the other hand, they don't respond to any antibiotics. So unfortunately for viruses, the treatment is just symptomatic care. Treat their fever, treat their runny nose, cough, congestion, use nasal saline, sinus rinses, help them to feel comfortable when they're sick. Now, I just gave you a lot of information that sounds kind of similar. So let's give you a couple examples so that you can help distinguish virus versus bacteria. So for our first example, your child developed cough, congestion, and runny nose yesterday. And then today, they spiked a fever and they don't want to eat some breakfast. So in this situation, let's start with common things being common. A virus is the most common illness in children. For this situation, the illness has been going on for about 2 days now. Viruses, they get worse in the first 3 to 5 days. And so with that in mind, we're kind of leaning towards, hey, this might be a virus. Now, if you were to go to the doctor at this point, the doctor would do a physical exam and they'd check to see if there's any obvious signs of an infection. And then they may do a swab to check for a virus, such as flu, COVID, or RSV. So for this case, let's say that the swab came back positive for the flu. Now the flu is a virus, and so main focus of treatment, supportive care. Now, let's change up the example a little bit. Let's say that the cough, congestion, runny nose have been going on for 5 days. But now your child is starting to complain of ear pain. If they're younger, they may even be crying more, pulling at their ear more. And you may even notice a new onset of a fever or a higher fever than they've had before. The key point of this situation is the length of illness. When an illness has been going on for 5 days or more and keeps getting worse, or if a fever is going on for 5 days or more, this is a sign that it might be a bacteria. In this instance, you'd go to the doctor, and the doctor would probably look in their ear. What you'd see is a picture like this. Now, what you see in this picture is the eardrum. It's red, it's bulging, it's irritated. These are all signs that there's a bacterial infection going on. And so your doctor is going to prescribe some antibiotics. Now, for example 2. Your child wakes up with a sore throat, a little bit of a cough and runny nose. They're still drinking well and they're still running around playing, but they're still occasionally complaining that their throat's bothering them. So, common things being common, this is probably a virus, especially with it just starting this morning. At this point, you'd continue with supportive care and continue to monitor them. So, let's change it up again. Your child wakes up in the morning with the sore throat. They have a fever, but they don't have the other symptoms. They don't have a runny nose or congestion. So, in this instance, you might think, well, is it a virus? It just barely started. But there's a couple other clues telling us that this may not be a virus. First, localized pain, just to the throat. And there's no other symptoms. There's no cough. There's no runny nose. And if you're to look in their throat, you might even notice large tonsils and some white stuff on those tonsils. Now, if you were to take them to the doctor at this point, the doctor would do the physical exam, they'd see the tonsils, and then they'd probably do a swab to check for strep throat. In this instance, the swab came back positive and they have strep throat, which is a bacteria. And so we can treat it with antibiotics. So, for the last example, your child has cough, congestion, runny nose for about a week. They're still running around, playing, acting their normal selves and drinking well, but it's been a week, and so you decide to go to the doctor. Now, of course, common things being common, this is probably just the tail end of a viral illness. Your doctor may or may not hear a little coarse breath sounds, and in the end, they'll tell you that it's a viral infection that you can continue to wait and let it resolve on its own. Now let's take the same situation and we'll change it up a little bit. You still have the cough, runny nose, and congestion for a week, but now you've got a fever. And you're noticing that the cough is getting a little bit worse, kind of more wet sounding, and your child may start complaining a little bit of some chest pain or some stomach pain. In this instance, we've got worsening symptoms for the past week. These worsening symptoms are a sign that there may be a bacteria growing. When your doctor takes a listen, they may hear crackles just on the one side of the lungs. This is most likely some sort of pneumonia. Now, some doctors will even send you off to get an x-ray, and this is what the x-ray will look like. You see these white patches here? That's the pneumonia. This needs to be treated with antibiotics. So here's the bottom line. Most childhood illnesses are viral and will get better on their own. Feel free to treat the symptoms. Give them lots of rest, good hydration, and time. Now, if these symptoms are persistent, this may be a sign that you have a bacteria, and you should go see your doctor. They may want to prescribe some antibiotics for it. I hope this helped a little bit to clear up virus and bacterial infections. That's it for now. Stay healthy, and I'll see you next time.